So we're going to talk about the oral cavity. So starting from the top all the way to the bottom of our digestive tract. Now the oral cavity is the beginning of your digestive system. So in this image, you can see that there's quite a bit involved with the oral cavity and the anatomy of it. You will not be expected to recognize the structures of the oral cavity except for the tongue. Now when we're talking about the oral cavity, the major structures will include the lips, teeth, tongue, oral mucosa, and the associated salivary glands. Now, when we're talking about the histology portion, which is the oral mucosa is the mucous membrane lining, which is inside of your mouth. Now, this is going to be referred to as your oral epithelium. So with your lips, for example, you're going to start off with SSK, which is stratified squamous keratinized epithelium. But once we go into the mouth, which is that oral epithelium, it's going to change to SSNK, which is stratified squamous non-keratinizing epithelium. And beyond the oral mucosa and the epithelium, there's also an underlying connective tissue termed lamina propria. Now, the lamina propria is a thin layer of loose areolar connective tissue which lies beneath the epithelium, and together with the epithelium and the basement membrane, it makes up the mucosa. So the external surface of the lip is covered by skin with a thin stratified squamous keratinized epithelium and hair follicles. So right here, which is the top, so this is the part of the lip that's close to your chin. Okay, so you're gonna find that you actually have a little bit of hair follicles around there. And then, so right here, so you can even see those hair follicles. Okay, now as you get to the big part of your lip, which is the pinky color, it's going to transition. So right about here. And it's going to transition into a zone called the red-free margin zone, also known as a vermilion border. And this portion is highly vascularized, so you have a lot of blood supply here. Even from this image, you can see how quite red it is. So this is the reason why we actually have color in our lip. It's due to the fact of how much blood supply we have to our lip. So if you were to cut your lip a little bit open, you'll find that you'll bleed a lot. Now from this portion of our lip, as we transition into going further into our mouth, we're now entering this area of stratified squamous non-keratinizing epithelium. Now, of course, we know that with keratinizing is going to help waterproof our skin. Now, because we're not exposing the inner part of our lip to the environment, we actually don't need keratin, which is why the inside of your lip is going to be lined with stratified squamous non-keratinizing epithelium. So now we're going to talk about the mucous membrane of your cheek, so the inside of your cheek. Now your epithelium, again, due to the fact that we're not exposing this part of our epithelium to our environment, you actually don't need keratin. So it's going to be lined with stratified squamous non-keratinizing epithelium. Now, with the inside of your cheek, you're going to have quite a few glands. You're going to have mucus glands and serous glands, which are found in the lamina propria. So right here, you can see that we have our epithelium, quite a dense layer. Now our lamina propria is all of this region right here. Now lamina propria is going to supply our epithelium with the nutrients that it needs. Since we know that our epithelium is avascular, so it actually doesn't have any blood supply in it, but it's getting fed its nutrients through our lamina propria. Now when we're talking about salivary glands, they're known as serous glands because they're more watery in appearance. Okay, so it's all of this pinky area right here. And we also have mucus glands. So mucus glands are these large puffy looking glands right here. Okay, so that's going to help produce mucus. And then right below that, we actually have quite a bit of skeletal muscle. Now you're going to need skeletal muscle within your cheek because it is voluntary. So this is going to help when you're talking, when you're chewing your food, or any sort of movement that's happening around in your mouth. You're going to need skeletal muscle since it is a voluntary movement. So when we're talking about the tongue, the surface epithelium of the tongue is quite rough. If you want to stick out your tongue and look at it in front of the mirror, you'll notice that the texture is quite rough. And this is due to the formation of papillae, which is known as these little extensions of various types. Now, the distribution of these papillae vary from one region to another of the tongue. So in humans, we have 4 different types of papillae. We have filiform, fungiform, folate, which is not totally well developed in humans, and we have circumvallate. Now, taste buds are commonly found on the latter 3. So you're going to find that you have taste buds associated with circumvallate, fungiform, and folate, but not filiform. And our taste buds are known as barrel because of its shape, okay? And it's due to the shape collection of the receptors and the support cells which line in our taste receptors. Now, circumvallate are known as the biggest papillae, located all the way at the back of your tongue, and you have about 12 to 15 of those. Filiform and fungiform are found throughout the surface and are quite intermingled with each other, so all throughout your tongue. Now, folate is found only along the sides of the tongue, and this one is not quite well developed in humans. Now, again, with our tongue, it's important to note that it's essentially a big muscle, and our tongue, because you have control of how you move it, it has skeletal muscle. So you can move it in different directions. So if you want to stick out your tongue, move it side to side, move it up and down, even moving your tongue out in a circle, or even the way that you talk. This is all voluntary movement. So due to the fact that it's voluntary movement, it is using skeletal muscle. Now, of course, on our tongue, you're going to have a lot of mucus and a lot of salivary glands. And because our tongue is quite a strong muscle, you'll find that there's only a little bit of adipose tissue. So here is a microscopic image of the tongue at low magnification. So you could tell already that majority of this slide consists of our muscle fibers. That's here all the way down into this region right here, Renault-Thorel. Okay, so that's all muscle. So you may find that you have a little bit of pockets of these adipose tissue deposits, which is just a little bit of fat here and there. And that's completely normal. Now you're going to find that the oral mucosa, so we have 2 different populations. So this spiky zone right here is known as filiform, just by how spiky it is. And now filiform actually has keratin on top. So here is a zoomed image of filiform right here. So you could see the dense layer of keratin on top of our actual papillae. Now, as our filiform transitions out, we actually have another area right here that isn't spiky. Now, this area that's not spiky is actually known as fungiform. Fungiform is not spiky though, and it does not have keratin. But fungiform gets its name from it looking more so like a fungi, so a type of mushroom. So you can see that it's like that. And again, we also have a lot of salivary glands, so our serous glands, and we have a pocket of mucus glands. So again, just to reiterate what I just spoke about, when we're talking about filiform, it has a specialized epithelium. And what makes it special is the fact that it's stratified squamous keratinized epithelium, so it has keratin, and it has no taste buds associated with it. And the purpose of filiform papillae is to actually help grip your food down. So the spikes are essentially like little Velcro hooks. So it's little hooks to hook in your food. And it's more of a whitish color. And here are the other three papillae. So here we have fungiform, folate, and circumvallate. Now fungiform is called fungiform because it looks a little bit like a fungi, so mushroom in shape. Now the other two are a little bit more roundish in shape. Now circumvallate is the largest one, and a way to remember is C comes before F, so it's larger in size. It's just something that I use to help when studying, and of course if that doesn't apply to you, then don't worry about it. And we also have folate, which is very similar to fungiform, but folate has a little bit more of a rectangular look than a mushroom look. Now, these three papillae will have taste buds associated with them. So they're a little bit like barrel shape. They actually extend perpendicular from the basement membrane to a little opening formed in the epithelium, which is known as the taste pore. So in this area and in this pocket, you're going to find that you have a lot of sensory cells that extend with microvilli into the taste pore. Now these microvilli will contain the receptors for different basic tastes, such as sweet, salty, bitterness, or even acidic tastes. Now here is a very close-up image of what filiform will look like, those spikes. Now, obviously in humans, you can't really tell too much, but you can actually see how it appears on animals such as cows or even cats. Since many of us do have cats, you could tell that they have more of a rough tongue. So when you're looking at a cat and they accidentally go to groom themselves or they get their tongue stuck on a piece of fabric, you might find that it actually really hooks on. And that's the purpose of filiform. Now, the purpose for us in humans is to actually grip down our food. But the reason why our tongues are rough is due to filiform.